We will get back to normal. I want to let our business owners, particularly those who run restaurants and food service business industries, that I appreciate wholeheartedly that you have been impacted and that you all are experiencing some severe financial hardship. However, in the coming days, there may be some relief for you. Um, I ask that our citizens pay attention to the news and follow the instructions as provided from state and local government with regard to how to deal with this outbreak. This virus, this situation is developing, and at one point some information may be good, and at another point information may not be as good as it was before. As previously indicated, one time they said masks weren't necessary. However, now we're finding out that possibly the CDC will indicate that masks may be necessary. So I say that to say this: the situation is not static, it's fluid, and it's changing daily. So you need to pay attention, be vigilant, so that you can protect yourselves and your loved ones. I would like for you all to know that the state government is doing its absolute best to get you the things necessary and get you the information necessary so that you can make good informed decisions. Now is not the time for pointing fingers and suggesting someone's not doing what they're doing. We'll have a time after this is passed to make an assessment as to who did what and who didn't do what. Right now, our number one goal is the safety of our citizens. It is important that you wash your hands, not hand sanitizer. Wash your hands, sing happy birthday, 2 verses of it, but it's important that you do that. The other thing, which is most difficult for me, is that you don't need to touch your face after you've touched different surfaces, particularly like this desk that I'm in front of. It is those small things that if you abide by, you can make yourself more safer, and you can be safe for other people. The other thing that's most important is social distancing. For a lot of us, that's very hard because social distancing requires us not to do the things that we have normally done, like go to church on Sunday. That's very hard for us. Or sit down in a restaurant. However, if we practice social distancing, we do what you've heard on the news, we lower the curve, we bring down the new cases, and that way we can hopefully resolve this virus in the coming months. Are we going to talk about the loan program?
Yeah, please, if you don't mind.
Okay. For our small businesses, the federal government has created the Paycheck Protection Program. This is very important. It's a loan that can come from the SBA, but what's good about this loan is if you follow some of the criteria that they've outlined, the loan will be forgiven. So the Payment Protection Program is a loan designed to provide a direct incentive for small businesses to keep their workers on the payroll. The SBA will forgive loans if employees are kept on the payroll for 8 weeks and the money is used for payroll, rent, mortgage interest, or utilities. What the loan is designed to do is give you a maximum of 2.5 times your gross monthly payroll receipts. So if you're a business with less than 500 employees, you need to be on the phone with your accountant now. I got a call from my accountant who's offering to do the service. You need to talk to your accountant because they can prepare the necessary documents for you. This program is so new and so unique because it just came as a part of the CARES Act, which was passed last week. So there's a lot of questions that are not necessarily being answered, but the people that are best equipped to do that are your accountants and your professional tax preparers. But I urge our small businesses, particularly our hair salons, and see I just touched my face, which I should not have done, but our hair salons, our food service business, any small business with less than 500 employees, this is a chance for you to get a lifeline to keep you afloat in these difficult times. And from what I'm told, but if you engage in this loan program, if there's subsequent loan programs that come out, if we need additional help from the federal government, you will not be precluded from using those subsequent programs because you partook of this one. So this is a golden opportunity for those small, and it can even be a sole proprietorship. If you got a lawn service and you employ people, if you need to avail yourself to this, it's vital. And if for those of you that are looking for help, and I know a lot of people are reticent about taking out loans. I, for one, am one of those. You don't like to get loans unless I absolutely have to. But in this instance, if you adhere to the terms of the program, it turns out to be a grant rather than a loan. And even if, and this is from one of the good things I've understood, even if you happen not to adhere to all the terms of the program, the loan is a fixed interest rate of 4%, and it can be repaid over 10 years. So it's virtually a win-win situation. So please, ladies and gentlemen who own businesses, avail yourself of this program. Get on the phone with your accountants today, because it's one of those first in line things. So if you're first to the trough, you get the most. But I strongly urge, in closing, and I'm going to step back and we're going to turn it over to Dr. Gamble, who's going to give you some vital health information. I want you all to stay encouraged. Do not be discouraged. Use good common sense. Protect yourselves. And like I said in the beginning, this thing had a beginning, it's going to have an end, and life's going to return to normal. Let's just continue to have each other's backs and continue to watch out for one another. Thank you.
Thank you, Representative Knight. Let me just point out one thing, and I appreciate it. He and I talked about how we might share information today, and he was kind enough to say, well, Senator, I'll take this part. I just want to mention that one of the important things about what he mentioned as it relates to the 2.5 month thing is the idea is that employers will keep their employees on the payroll. And so it's all designed to make sure that even if you're not working, for the next 10 weeks, there's money there to pay your employees during the difficult time when you aren't actually getting money in. And so please, sirs and ma'ams, let us utilize what is before us. There is $350 billion that has been allocated in order that it might stimulate our economy on the one hand, but provide income for those regular working citizens out there on the other hand. One of the other questions that's been posed to us, and if Dr. Gamble doesn't mind, I'm going to ask him to just hold his horses, as we say in Waynesburg County, a little while longer. We've gotten a lot of questions about whether or not my child is going to be graduating from high school and what that's going to look like. And so we have asked Dr. Wilder to please come and share some information with the citizenry in that regard. And so this time we're going to ask Dr. Wilder, if she doesn't mind, please, to come up and share some information.
Good morning. Before I address the seniors, I'm going to share a few other things with the community in reference to continuous learning for our students. Please know that to the best of our ability, we are providing quality education to our students. Our teachers are doing an excellent job of sending learning packets to the students. We have picked up the first round, or the first set, should I say, of learning packets. Thanks to our bus drivers who are on the job. The parents were able to send the learning packets back to the school to be checked. Please note, parents, that the packets are not being thrown in the corner or thrown aside. They're actually being evaluated for the quality work your students are doing at home. We also want you to know that we are doing a blended approach. And what I mean by the blended approach is some students may be receiving virtual assignments, some students are receiving paper pencil. That's because all of our students do not have technology at home. Special thanks to Farmers Telephone and Spectrum, who've actually given our parents 60 days of actually free internet service. So parents, if you're talking with another parent, and this parent is saying, well, my child has an assignment on the Google Pad or Google Teacher Network, and my child has paper pencils, because that we do two types of assignments. As I say, one is technology, or should I say virtual, and one is actually paper pencil. I have to also give credit to my teachers and my principals who are doing an excellent job. They're working around the clock. As a matter of fact, I think some of my teachers are busier now than they were for me in school, because it takes a lot to communicate with the parents. I want to say to the parents, please continue with your questions that you're asking me. I've responded to your emails. I've responded to your telephone calls. Anything that you have a concern about, please feel free to call. I will be there to answer those questions for you. Now for our seniors, this is a hiccup for all of us. I really have just been grieving about my seniors. But I want our seniors to know we will get through this together. Most recently, the state has developed a statewide plan for all seniors to complete requirements for graduation by May 15th. On this past Tuesday, I met with the high school principals and the high school guidance counselors, and I can assure our students and our community that we are on task with our students graduating. I'm very pleased to say that at this time, I feel very comfortable saying that 99.9% of our seniors are ready and will meet the deadline of May 15th. Our principals have actually also set up conference calls with some of the seniors. The seniors know to contact the guidance counselors. The guidance counselors have done an excellent job in staying in contact with the students. Most recently, I sent a letter to all the seniors, and I also sent with the letter an anticipated set of questions that the seniors may ask. I know they're worried about, are we gonna have graduation? Are we gonna have prom? At this time, I cannot answer those questions, but I will assure the seniors that if possible, we will have those activities for our seniors, and we will plan as if though they will occur, but if they do not occur, that's no one's fault. Even though these are uncharted territory times for us, we will make certain that our seniors get out, or I don't want to say the term get out, but be ready to leave us on May 15th. If there are any questions concerning how we're doing this, please feel free to contact your child's high school, the guidance counselor. You can contact me by email. And as a matter of fact, I put in the letter to the seniors my cell number so they can call me directly. So if there are any concerns or questions and concerns in reference, any concerns for our seniors, please feel free to contact me, the principal, or the guidance counselor. Thank you.
Thank you, Dr. Wilder. We all appreciate all that you all are doing, and want to especially express our appreciation for the meals that are being prepared, that are being delivered to our children. We are all mindful of the fact that unfortunately we find ourselves in America in a place where there are some children that still look forward to that one sure meal, and that's a societal issue that we can do better at. But we are appreciative to our school district for providing those meals to our children. And so I'm going to ask now that our chief medical officer of the, well, absolutely, Dr. Wilder, please. No, ma'am, please.
Sorry, thank
no,
you.
absolutely.
Thank you for mentioning meals. I want the parents to know and the community to know that during spring break, please note that meals will not be served during spring break. And speaking of meals, I forgot to mention my food service staff members. These men and women have been working around the clock. As a matter of fact, we modified the meal delivery from a 5-day delivery to 2-day delivery. And we did this to enable that staff to get some time off. So on Monday, the students receive meals for Monday and Tuesday. And on Wednesday, the students receive meals for Wednesday, Thursday, and Friday. So that's an update on our meals. Again, there will be no meals served during spring break. Thank you.
Yeah, thank you, Dr. Wilder. Another indication of folks going above and beyond the call of duty to do what they can to make life better for folks during this difficult time. And so now we're going to ask Dr. Troy Gamble to come in his own way and share information. And after Dr. Gamble is finished, we will be delighted to spend some time answering questions that might be coming through the feed here. We realize that Dr. Gamble's time is probably a little more demanding during these hours, and others of us, we might not be able to embrace all questions at this particular time. But we'll try to create an opportunity to answer questions that we don't get a chance to answer right now a little later on. And so we will now ask Dr. Gamble to please come.
Thank you, Senator Sabb, Representative Knight, Doctor. Thank you most. My mother was a school teacher for 40 years, and the fact that you're an educator and you're educating our children, that's key to the survival of our country and our society. So thank you for all you're doing in this difficult time. A couple of things I want to bring to your attention. This is a pandemic. It is very serious. It is very life-threatening. It is very, very, very contagious. It threatens all of us, and it has to be taken seriously. I had to go to Florence the other day. My water pump was malfunctioning, and washing my hands is imperative, even in my own home. And so I had to go in Lowe's to buy parts for a pump. And there were people all over there not social distancing, not wearing masks. I recognize that the CDC has said that it's not necessary that you wear masks. I'm wearing a mask today for a number of reasons. Number one is that I'm exposed to it daily. I'm in the hospital, I'm seeing the potential COVID patients. I never know who's going to cough on me next is going to have COVID. So I'm wearing this mask to keep my droplets from flying out and infecting you. I noticed there have been some policy statements coming from some places that the masks that people are making and offering to make are not good, and that don't expect them to protect you. My argument is that some mask is better than no mask. When you look at people who get infected, one of the things that makes you get infected is the inoculum size that you're exposed to. In other words, the number of germs that get blown in your face. If you're wearing a mask, even though it doesn't block out all the COVID, it blocks out some of it, so it reduces your inoculum size. I'm not the CDC. I'm not an infectious disease expert, but I've practiced medicine for 40 years. I've lived through many, many flu seasons, and I can assure you, I believe wearing a mask has helped me not be ill very many times in my 40 years of practice. So for those of you who go to the grocery stores, for those of you who have to go shopping, that you have to go out, please put on a mask to help protect you and to help protect you from infecting others. When you sneeze and cough, if you've got that mask on, you're reducing the inoculum size that goes out among you. The issue has come up with churches. I'm as devout a Christian as many people wouldn't believe that, but I've spent my life trying to serve others as part of my Christian faith. And I don't tout it very much, I don't talk about it very much, but I feel very strongly that my service to others is part of my Christian faith. And so I'm a big believer in churches. My minister, who I'm lucky enough to say is one of my patients, would tell you that I don't warm the seat of the church very much, but I don't warm the seat of the church because I'm busy running your hospital most Sundays. But the issue of having church right now is truly a bad idea. I understand, just like with my own church, we sent out a memo saying, look, church is important, spirituality is important, but we have an obligation not to infect one another. And so we actually have set up an online payment to our church so people can tithe from home. Many churches are streaming their services. It is not a good idea to have church services right now. Even if you social distance in a small room like this, remember these are air. We believe that the surfaces transmit this stuff on your clothes, on your face, on your hair, where the virus is sitting can transmit it. But droplets do. Those droplets, 6 feet's great, but some of those droplets are getting sucked up in this air return and then blown back over the rest of you in this room. Now, again, I don't know about inoculum size, but I'm smart enough to know that I don't want to be sitting in a room with a bunch of people, even if I'm sitting 6 or 12 feet. If you've ever traveled on an airplane, I can assure you most of you have come home with a common cold after you traveled on an airplane, just from the common cold circulating in that airplane. So remember, this coronavirus is an old common cold virus that has mutated and has become more infectious and more dangerous and affects the lungs more violently or more severely. So it's not a good idea to have church. You must remember that at least on the statistics from China, and that's all we have to work on right now, but from the statistics in China, people over 80 years old, if they contract the coronavirus, their statistics suggested early on that 1 in 4 of those people, 24% of those people were dying, okay? If you are age 60 or 65 to 80, you have a 14% chance of dying if you contract it. Now, younger people, luckily, and the population in general, 97% of us will recover, but when you look at that 3% that don't, and you calculate that over the 350 or 60 million people that live in this country now, that's a lot of deaths. And those deaths are going to affect you. There's nobody that's going to get out of this without being affected. So please, please, I implore you to take this very seriously. And with that said, I'll leave that topic. Let me tell you what your hospital is doing for you. We are the second or third largest employer in Williamsburg County. Our board voted this morning in an emergency session to allow our CEO to sign the request to obtain these funds that our two state legislators have alluded to this morning, so that we might provide funding to keep all of our employees employed during this difficult time. It's no secret that Williamsburg Regional Hospital, in the 7 years I've been here, we've operated on paper clips and rubber bands, but we've kept it together. We have excellent outcomes. I'll put our outcomes against anybody anywhere in the state. And so I think we're running a facility that serves this community and is useful to this community. And we also provide part of the financial heartbeat to this community. And it's our goal as a hospital, our board of trustees, we are doing everything we can to keep these people employed, to help keep our economy locally from imploding. So with that said, Ms. Poston will be signing that request later today. Our accountant has already put together the information to allow us to be able to continue to fund our employees so that we can keep our hospital open to provide you services. Another good thing that's come about in the last couple of days, when we put up our temporary hospital, when our hospital was destroyed by the flood, one of the things in the cost cutting to enable us to even do this, we left off doors in our intensive care units and went back to the days where we separated rooms by curtains. With this COVID virus, we can't treat people where we might contaminate everybody in the room because they're open and separated by curtains. And so we obtained a request to put doors on our ICU. Our hospital foundation said they could give us $8,000. That was the initial quote. However, when we had the people come look, it actually cost $16,000. Within 48 hours of calling people and friends and leaders in this community, we've already covered the cost of putting these doors up. The doors are being ordered, and we are in the process now of collecting money that hopefully will buy 2 additional ventilators so that we might provide ventilatory support. We have a staff that's fully capable of managing people on ventilators. We do it every day. We just don't have a lot because there heretofore has not been a big need for prolonged ventilation in people here with our large tertiary care centers on either side of us. But in this case, we're trying to help take the burden and load off of our larger hospitals. One day last week when we called MUSC Florence, they were down to 2 available critical care beds, and so we're trying to expand that capacity. The other thing is, as a citizen, please remember that staying at home right now is most important. If you stay at home, you don't get infected. If you stay away from other people who might be infected, you don't get infected, so that the healthcare systems get overwhelmed. We had contracted the number of our hospital beds throughout this country in the interest of cost, and now we're paying the price because we've done that, because we probably don't, now we're struggling to put together the facilities and things to do it. You see what's going on in New York City. So we've done our own little microcosm of trying to make support available, and I think we're pretty well there. We'll have these doors installed shortly, and We also have one of our 3 units, one of our patient care units that's designated to COVID care only, so we can isolate those folks so that we don't spread it to other people in the hospital. With that, if there are any questions, I'll be happy to try to answer them.
Have you seen any COVID patients yet, or anyone that's tested positive?
We've had several come into our emergency room who primarily have been people who traveled from New York or elsewhere where the hot spots are in the country that were so ill they had to be intubated and transferred to other facilities. As you can see from the cases, I think there are only 2 or 3 cases right now that have been reported, or 5 now as of today. I didn't look at it this morning, I've been so busy. But right now we are low incidence, there are only 5. You must remember though, there are many people walking around out there, young people who are asymptomatic, that have good immune systems, and for some reason they walk around asymptomatic, so there's more out there. The other thing is if you look at the numbers throughout our state, Columbia, Charleston, and all of our big metropolitan areas, the numbers are starting to rise rapidly. And so our peak is going to be a little behind New York's and LA and some of the bigger urban centers. But you are going to see it's going to come here in the next couple of weeks. It is going to affect you, and it is going to be critical that you wash your hands, that you stay out and stay at home unless you have to go somewhere. If anybody's coughing or ill, if you have cough, fever, or shortness of breath, please seek one of the many modalities that are available. We now have, within the last 48 hours, we've put up telemedicine platforms so that people can call in our practices and be treated by telemedicine. We also in working with MUSC has a number that you can call and go on the platform and answer questions, and then they have testing stations here and in Florence and other places. I think they're even trying, have one in Lake City perhaps, that you can obtain testing for the symptomatic people. So things are falling into place for us to try to limit this. Again, the big problem is to not have everybody get infected at once and overwhelm our ability to take care of you. And so even though this may last a little longer, because we're asking you to stay at home and social isolate, it also is going to reduce the number of cases and not overwhelm our healthcare system. I think New York City's healthcare system has been overwhelmed. I think you see the governor every day requesting help, requesting doctors that have retired to come back to work, requesting nurses that are retired to come back to work because the system is overwhelmed there. So, but they're doing an extraordinary job. I think this is one thing that's become apolitical. I think both of our political parties seem to be pulling together and helping us resolve some of these issues quickly, and that's the way we should run this country, by compromise. And so I think there are a lot of wonderful things going on from top to bottom, from the president all the way down to our local senators, representatives, and all of our people in our county. And I just say one more word about the people in Williamsburg County. Their response to our needs to help keep our hospital open and functioning and providing services almost brings me to tears. I've always been a big lover of Williamsburg County. I was near retirement, didn't have to come back here, but my family's lived in Williamsburg County since they came here in the 1700s, and I love Williamsburg County. I love being here, and I love being a part of your hospital system.
Do we have any stations here for testing, or are there going to be here?
Do we have what?
Testing stations in Williamsburg County.
I'm not aware of that right now, and the reason there hasn't been is that, you know, we've had such a paucity of cases so far, but I would imagine that we could crank that up. We've been working with DHEC. We have testing available through DHEC, through Mako Lab, and through LabCorp in our own hospital. And so each group sending us what supplies they can, and so we have the testing available. We've tried to keep it to the people who need hospitalization and all for our hospital, so that we don't use up all of our hospital resources, so that we can operate for the very ill. It's not helping if you just decide you want to go get a corona test and you don't have any symptoms. You're using up needed resources for people who are sick. So if you're not sick, the best thing you can do is stay at home, wear a mask when you go out, wash your hands, keep your hands off your face. And if you get shortness of breath, cough, and fever, please seek medical care immediately.
We have some citizens asking if they can't, if masks aren't available, what should they use?
Even from the president down, they're suggesting that you use a scarf or anything to cover your face and nose. Put a couple of layers of a scarf on. I'm amused that people are saying not to make masks and not use them for the general public, and I think they were really mostly talking about people in hospitals and things not to use the handmade masks. What we're doing is because of the shortage of supplies, where we were about to run out of the N92 mask, and I'm going in rings perhaps with one N92 mask for a whole day. What I'm doing is putting this type of mask on, putting the N92 on, and then covering that with yet another mask like you have, or a mask that I can dispose of, so that I can very sterilely take that off, dispose of the outer mask, reuse the middle mask. That may not be perfect, but in wartime, when you run out of bullets, you throw rocks at one another. So that's what we're doing. Anything else? Thank you again. Thank you for the support of Williamsburg.
Wait a minute, Doc. I have a question I would like to ask. You say that you guys have ordered two additional ventilators. What are your chances of getting them, and how long span of time do you think?
We think we can get them pretty immediately. The federal government is cranking out ventilators with many of the ventilator companies now. Our local vendors usually have some refurbished ventilators. We'll take anything we can get. We have two ventilators. We actually have another ventilator or two in our emergency management trailer that may have to be refitted in some way to crank them up. And we actually have a ventilator in our operating room for our operative services, but I don't want to have to take those out of service for somebody that might need emergency surgery or other things. I keep reminding my colleagues that even though we've got this COVID virus, there's still people having heart attacks, still people having strokes, still people developing appendicitis that need care, and we can't lock down to the point that we're not serving those people as well. Right now, I think we can handle it. Hopefully, we can get these two ventilators very quickly. We've almost raised the money. We've already paid for the doors. We're almost to the point where we can pay for the additional ventilators without trying to borrow money. Lord knows our hospital doesn't need to borrow any money. We need to come out of the hole instead of staying in the hole, and we're slowly doing that. But we hope we're going to be able to provide the services that the county needs. Okay, thank you.
Thank you, Dr. Gamble. We are better off and better served as a result of our homeboy coming home and staying home. We appreciate all that you've done and all that others are doing. There are just a couple other things, Representative McKnight and I wanted to mention before we conclude. And one of the ones, and it's just something that's been asked of us, and so we know that we have had a problem with the Department of Workforce and Development as it relates to the amount of applications for unemployment. And so it's one of those situations where the system, quite frankly, was not built for the amount of applications that are being received. But we want to assure everyone that benefits are forthcoming and that the bugs that are in the system are being worked out. We understand that, I think it was last week, there was a record number of applications, and I made a note about it, 64,856 applications in 1 week. It was an all-time record. The prior record was set back in 2002, but it was only 41,000 that was given at that time. And so we anticipate that the numbers will continue to rise. The good news is that the federal government has propped up those unemployment benefits such that rather than the normal amount that's being given, the minimum amount is going to be $600. and that amount will be maintained for a period of time, I believe up to 16 weeks. And so we just don't want anybody to give up on that which is out there and available for all of you to access. And so with that, is there anything else y'all represent? All right, so we just want to thank everybody, thank Channel 2 News, thank we call her our reporter, Michelle Dukes, and thank those of you who've tuned in. And please, if there's anything that Representative McKnight or I can do, or Dr. Wilder could do, or Molly Spearman can do, or Dr. Gamble can do, or Sharon Poston or any of the other staff, please know that we are there to serve you. Thank you so much, and God bless.